I'm going to get started here with class. I'm Dr. Amber. For maybe one of you that hasn't quite met me yet, you'll see me adjusting everyone in the office, but you will see me treating a lot of kids and babies, and that's always interesting to new patients in the office if they've never been around chiropractic care, because they always wonder why they might need adjusted. The first subluxation usually happens at birth. Remember we talked about that? The misalignments that can happen up in here during childbirth can stay that way and start to cause the symptoms that we have as adults. So that's why we do check a lot of kids and babies from anything from symptoms like colic or ear infections and bedwetting, or even ADHD type of situations, which we'll get into here in a minute. We focus so much of our life centered around our pain and the symptoms that we have that we forget about the other things that are going on in our body that aren't necessarily related to our pain. And so that's why we do that goal sheet with you, because we need to start thinking out of the box and going into those other symptoms. If you remember from your first visit, we had the 3 types of nerves: pain, motor, and autonomic function, right? And remember, the pain nerves are such a small portion of the nerves, 10%, that just because we're not in pain in certain areas doesn't mean we're not having dysfunction at the nerves in those areas. So when you guys first came into our office, you really wanted to get out of pain, right? Or you wanted relief from your pain. Were we the first place that you tried?
Yes.
Yes. In some cases we are, and in some cases we aren't, right? Usually the first step in the pain process is the sign or the symptom that something's going on, and it is going to be the pain. It's usually what takes that person to get in our door first off is debilitating pain that they may have had for years, okay? We want some kind of relief, and typically our first route is going to be some type of medication. Would you agree?
Yeah.
Yep. And we now know that the medication doesn't always fix the problem. It usually makes it worse by covering up the symptom or adding more symptoms onto our list of symptoms. Okay? So when you came into our office wanting relief, other areas of treatment may have failed you, and we feel one of the big reasons why that happens is because of the miscommunication or the misunderstanding about what's expected from certain treatments. So that's why one of the reasons we do this class is just to help you understand better what to expect from your care, especially with chiropractic care and the benefits that you can get. By going out and going to the medical doctor and having your annual exams and your physicals, or going in with symptoms, what you're doing is you're starting the process of the disease process once you walk into the door. If they don't find anything with you, then they'll see you again next year and they kind of pass you along. And there's no real preventative care there. That's one of the things that we focus on in our office, is trying just to be more preventative with our healthcare and be more wellness-based, right? Because we do see a lot of families and kids in this office, we're seeing chronic disease being diagnosed in kids younger and younger. Types of diseases that only used to be in adults. Like, we remember our grandparents having type 2 diabetes, and now there's 10-year-olds being diagnosed with it, right? A lot of disease processes are starting out in younger and younger generations, and it's those chronic diseases that a lot of times can be irreversible with the right education and the right change in lifestyle. But we don't see that type of prevention happening a lot in our healthcare and society these days. So that's one thing we always want to focus our patients on, is just being in that more preventative mindset with your healthcare. Our education about our health typically comes from the television, because we watch a lot of TV, right? And what do we see on there? We see a lot of advertisements for our food that we eat, which is usually the highly processed foods that have all those long words in it that we can't pronounce. The more words in it, the better it tastes, but it's usually the worst for our body. Remember the 3 types of stress: physical, chemical, and emotional? Your foods, your overly processed foods, is going to fall under that chemical stress. Okay? Who thinks the drug companies want us to become well and stay well?
Not even close.
$41 billion was the top grossing pharmaceutical company last year. And that's just on prescription drugs. So that's such a large part of our healthcare based on just prescription drug use. The average 65-year-old takes anywhere between 8 to 10 prescription meds, and they're usually on 3 or 4 for the same type of symptom, right? Off-label prescribing, have you guys ever heard of that? Very popular in the medical community, prescribing you drugs that the drug isn't necessarily approved for, and hoping that it works.
Experimental.
Yeah, so in turn, you're becoming a guinea pig for the medical community to see if it'll help with your symptoms. When I have 10-year-olds coming into our office with bedwetting symptoms and they're giving ADHD meds, one, it's not going to help with bedwetting, but two, it's not approved to treat any type of symptom similar to that. So why are we giving it out? Okay. Becoming more educated about our health and taking more of a responsibility is where we want our patients to be. Start asking questions. Never be afraid to get second opinions ever from any type of healthcare you're receiving. Like I said earlier, when we start to take the drugs, we're starting to suppress the symptom. And what is the symptom in our body? It's our check engine light, right? So if we ignore the check engine light in our car, what's most likely going to happen?
It's going to break.
It's going to break and it's going to stop working. We hope that our symptoms or our check engine light never get to the point where we break, but that's what they're there for. And the more that we suppress them and cover them up, the more we're just wearing and tearing that car until it falls apart. Okay? There are a lot of major publications out there. Now that the election's over, we're seeing more and more, especially now, focusing on healthcare. It's scary where our healthcare is going to be going in the next couple years, right? But we see a lot of this stuff in major publications talking about where our healthcare has been the last 10 to 15 years. It's a National Geographic that we have from 2010, and what it does is it talks about the cost of healthcare in this country, what we spend on average per person. What do you guys think we spend on average per person in this country?
Quite a lot.
Yeah, because I'm covering up the top of the page so you know we're going up somewhere, right?
Well, medicine.
$7,200 is what the average American spends on healthcare.
Really?
Our life expectancy is 78 years old. Mexico spends $823 and their life expectancy is 76 years old. So just because we spend the most money doesn't necessarily make us the healthiest, right?
No.
We also rank 45th out of all the countries in the world for the healthcare that we provide, which is really sad. Okay. Not only are we spending a lot of money on healthcare in general, but specifically prescription drug use, like we talked about earlier. If we continue at that rate there, we'll be spending $5 trillion a year by the year 2050 just on prescription drugs. Okay, that's not on surgeries, outpatient procedures, MRIs, nothing, just prescription drug use. We are also killing over 500,000 people a year with our modern medicine, right? This was a study that was actually published in 2008 by Professor Gary Knoll, and it was performed by medical doctors. And they found that conventional medicine kills 783,000 people a year, which is equivalent to 5.5 jumbo jets, or about a little over 1,500 people a day. Okay? Medical errors also costing our country $24 billion each year. Does that sound like healthcare or sick care?
Sick care.
Exactly, right? And that's why you guys are in our office, because you're tired of that sick care model. And you understand now that your body's giving you these symptoms for a reason. Let's try to find out why they're there, right? Traditional medicine is great for emergency situations. If you chop your arm off or you fall down the stairs and break your leg, go to the emergency room, right? But a lot of stuff that our patients come in with, either we can get you before you've had some major procedure, but we see a lot of patients after they've had procedures, like spinal fusions or epidurals or those types of things that have failed them. Because a lot of times, least invasive procedures will actually be what the patient needs. And that's where we should start anyways, least invasive, and work our way up if we don't get the results that we need, right? Appropriate use of antibiotics and surgeries, that's always a big one that we put on there. Because really, since I do see a lot of kids, we're starting to create the superbug that's resistant to all of the antibiotics we have because we use them so much. I have so many parents that come into me and don't understand that it's not normal for their 2-year-old to have ear infections the whole first 2 years of their life. And they've been on antibiotics the whole first 2 years of their life, right? So where's the change? Nothing's going to change if we don't break the cycle, right? Only we are responsible for the health care of ourselves and the health care of our family, okay? The one thing that we like to really talk to our patients about is letting their health insurance specifically dictate the type of care that they get anywhere. Now that health insurance is changing over the years, whether it's covering less and less, we can't let that just dictate the type of care that we need. We have to go off of how our body responds and how it's functioning, right? As chiropractors, we get to teach people how to become well and stay well. And if you're not on that path, how to help you get there with the safe, natural approach, right? Remember how I talked about least invasive first? And that's one thing that we see a lot of in our patients, just the changes after receiving modern medicine for their symptoms for so many years. The changes we can make with even just 1 or 2 adjustments really blows people away. So it's really neat to see how the body can heal itself and function at 100% when we take away all the interference that we've been doing to it, whether it is the drugs and surgeries. That quote is up on the wall, and you guys probably had enough time to read it while you were sitting back here, but that was Thomas Edison, who I feel is a pretty smart man, right? Mm-hmm. He actually said the doctor of the future will interest his patients in the care of human frame, diet, and cause and prevention of disease. Do you guys see anything about drugs and surgeries in there? Mm-hmm. No. So here we are to our goal sheet. What I'm going to have you guys do is I'm going to have you write down 2 goals that aren't pain related like we talked about. Some of the first things that our patients tell us when they start under care is that they sleep better or they have more energy, taking less medications than what they had started with. Those are great goals. I had a patient that I had seen, I'd seen her for years, and she started developing shortness of breath, and that was one thing that she never told me because she didn't feel like it was something I could help with. She finally told me after her doctor put her on Advair. Mm-hmm. Do you know what Advair is?
Yes, I do.
It's steroid inhaler. Mm-hmm. If you read the side effects...
It's a long-term steroid inhaler.
Yeah, and if you read the side effects of it, the first thing listed on there is cancer. Mm-hmm. And that's what made her finally tell me, right? Mm-hmm. So I actually focused on adjusting this area up in here. Do you guys know why we would adjust that area?
Because it helps give more air to the lungs.
Yeah, those are the nerves that are going to feed the big organs called the lungs. So a lot of shortness of breath is related to subluxation up in here. So after just adjusting, and asthma, yeah. Mm-hmm. So after adjusting just for 1 week, she was fine. And she didn't have to take her Advair, which is good. But we've also helped a lot of people get off of those types of medications.